Hello, and thank you so much for letting me speak with you for a few moments. My name is Jennifer Novak. I am a distributor and an educator for a state-of-the-art, portable, and versatile Class 3B laser device. And your instructor asked me to put together a short video just so I could introduce you to this amazing technology and why it might help you augment your already successful practice. Because you're in this course to begin with, I know that you are one of the top echelon in your field. You're a thinker, you're a problem solver, and you're always looking for the best of the best to provide to your patient base. So, with that said, I represent two versions of a portable, versatile laser device from Avant Wellness. My distributorship is called Ortho-Neuro Performance Consultants because I am geared toward the sports medicine industry. And I worked with the clinical director for 2 years, pouring through the research to develop custom settings for the types of things that a practitioner like you runs into every day within your practice. This is how small and portable these devices are. They fit in the palm of your hand. This right here, our flagship device, offers red and near infrared light wavelengths, while this one offers red and violet, and it's a specific violet wavelength that helps with pathogen management. It's also good with scar tissue, skin conditions, wound healing, anything of the kind. This one is so versatile that you would use it probably on every patient every day. All of you are probably well versed with what photobiomodulation is, or it used to be called low-level laser therapy. And of course, there's been a surge of red light therapy devices hit the market in recent years. But this device, the technology is phenomenal, but this delivery system will completely set you apart in your field. You will love having it. You'll use it with every patient. I am developing coursework that will help you help others by understanding the mechanisms and capitalizing on those mechanisms to just really become the hero in your patient's eyes. So with all of that being said, I just want to run through a few case studies. I have some pictures and some videos, and I'll just briefly discuss a variety of conditions that have been tremendously helped in short order utilizing the Ortho-Neuro version of the Avant Portable Lasers. Thank you. So really quickly, I want to run you through just a few case studies of varying levels of difficulty. They say a picture is worth 1,000 words and maybe a video is worth 10,000 words, but this is the power of utilizing strategic and targeted light application with these custom pulse rates on the Ortho-Neuro version of this laser from Avant, and what you can do to augment your practice, even with dry needling, without dry needling. Every patient that walks through your door is going to have there will be a reason to use light to help them heal. So let's take a quick look. This one is a gentleman. He's an ex-collegiate athlete, gained a lot of weight, anyway, because he was a baseball player, he wound up needing a knee replacement in his early 50s. And I just want to show you this progression. If you look at the far left picture, that's what his knee looked like 2 weeks post total knee replacement. He was in so much pain that he was sent to me was referred to me by a physician because he was afraid he was going to get addicted to pain medication. He could not even get out of bed without taking some. So that picture was taken before his first session. Then the next picture is actually 24 hours later after his second session, utilizing very targeted light application. That looks like a different knee, doesn't it? Now in this third picture, you're just seeing a picture of his knee 6 weeks out, which still for a knee replacement I think looks really, really good. And the only thing at that point that was causing him pain is if he tried to do terminal knee extension. Of course, that's a goal of physical therapy, is to get that from somebody. But now I'm going to show you at the end of that session him walking away with nice terminal knee extension on that right knee, and that's about the time he gave up his cane and his physical therapy really moved along faster, which is super exciting. Okay, this next picture is a picture of a high school wrestler who had a dislocated knee during a wrestling match. And the picture on the left was the picture from the emergency room at about 11 o'clock a.m. on a Saturday morning. And the mother called me and said, do you think that light can help him? I said, it absolutely can. And what you're looking at on the right is his knee by about 4 o'clock in the afternoon, after again we used some targeted laser settings to really reduce the inflammation and start that healing process going. The key with laser is that you're promoting a positive cellular stress response, and then you're providing more energy from the cells to get it done. So that's super cool stuff. Now this young lady was a track athlete, really fast, and no amount of coaching though is changing her takeoff off the block. So I want you to see what it looked like. And we determined in her intake that when she was 8, she's 15 in this picture, she actually had a little head injury that was never diagnosed as a concussion, but she had some vestibular stuff and some eye movement stuff that was really throwing off her ability to just get up and going. But once she did get up and going, she was super fast. Well, we did vestibular work and visual work, augmenting that stuff with a laser. And this is what she looked like about 30 days later. And now, by the way, she is All-American in all of her events. She's actually 17 now. But at 16, she became All-American, and I love that for her. She came back to me recently, in fact, and we utilized a satellite cell setting that's inside my library of settings because she was getting repeated hamstring strains, and I guess a couple of weeks ago, the mother called and said, we did a second MRI and there's no evidence of injury. So you got to love that for your young athletes. Now, this young man I saw 6 years post in AVM. He was a high school lacrosse player. And what you need to know, or you probably already know, is that being able to do something as simple as Superman is really important for gait retraining. And I just want you to see, it took us about 6 months to get here, but here is a little video of him doing some Supermans. And if the sound were on, I would tell you that his mom at the end of that was like, wow, you did that so much stronger. Then we got him up in his wheelchair and I wanted to see him walk across the room, see how he did. And it used to be a real big struggle for him to just get up out of the chair, start thinking about movement. He had motor apraxia. And then when he started moving, you had to stop him because he couldn't stop himself. And this is what he looked like. He got right up out of that chair. I had a metronome playing. He was walking to the metronome. I foolishly clapped because I was so excited and actually threw him off. You can see him lose it a little bit from my clapping, unfortunately. But he turned himself around. He stopped himself at the end, turned himself around, came all the way back to his chair and sat down. And again, you can hear the mother in the background at the end go, wow, because it was such a huge difference from when we started working together. And this is very exciting to be able to provide this to people. Young man who had an anoxic brain injury actually 14 years ago. So it's been a while since the injury, and the first time he ever smiled at me is the picture on the left. It was in February of 2025. And then 4 months later, in June of 2025, thanks to, honestly, a lot of light therapy that was very strategic with this laser, this is a picture of him in June. And the difference in the look on his face, his ability to make eye contact, the countenance on his face is just night and day. And it thrills me to be able to show that this light device can do all of these things. Now, this is one example of what a custom setting can do for you. This is my muscle weakness setting, and it's on a diagnostic ultrasound. And it's quick, it's 8 seconds long, but you need to see in about 3 seconds, you'll see that muscle start to vibrate really gently. You see that? You see the vibration? And then when he turns it off, it stops. So that muscle weakness setting is actually vibrating the muscles so that they start reporting to the brain where they are and what they're doing. And that to me is just beyond exciting, to have something that you can do and specifically know what you're doing there. So this is how to reach me. And of course, your instructor knows how to reach me. I would love to support your practice and your capabilities by providing one of these devices. So anytime you want to reach out, I would love to speak with you about how you can incorporate these devices into your practice and become the hero of the day. Thank you for your time. Again, it's Jennifer Novak, Ortho-Neuro Performance Consultants is the name of my company. And you can email me at that jennifer@orthoneuropc.com to get started. Have a great rest of your class. Thank you so much for your time.